What we found is that a protein called ferroportin that eliminates iron from cells is reduced markedly in breast cancer cells compared to normal breast cells, particularly reduced in the most aggressive breast cancers. When ferroportin was high, the women did well. When ferroportin was low, the women did poorly. What we found in the breast cancer cells was that the level of iron was higher and the level of ferroportin was lower than in normal breast cells. We now wanted to examine breast cancer tissue itself. So we examined a large number of breast cancers that had been resected from women. What we found is that ferroportin was high in the areas that surrounded the normal areas of breast tissue that surrounded the cancer, but was reduced in the breast cancers and was greatly reduced in the most aggressive or mean-looking cancers. Well, we examined more than 800 women in 4 large studies from across the world. First, we found that the genes for the protein ferroportin and another protein, hepcidin, that regulates ferroportin, are markedly changed in these women with breast cancer and predict for outcome 10 years later. In the future, we may be able to direct our therapy based on the ferroportin level. For example, most women in the poor prognostic categories, in the relatively poor prognostic categories, are offered chemotherapy. It is possible, although not proved at this point, that those women who have a high ferroportin might be spared such chemotherapy. This is a study not about body iron, but about cellular iron. If it's one thing we learned from this study, is that the cancer cells actually subvert that normal, very delicate balance of regulation of iron. So we believe that there should be no changes in the diet or the dietary supplements that a patient takes. We and others in the future will be looking at ways to elevate ferroportin in women who have breast cancer and a low ferroportin, and those ways or those drugs that would do that might become important treatments for cancer. But I want to emphasize this is in the future. This is an incredibly exciting time in breast cancer research right now, and we are very pleased that our study has in some small way contributed to our understanding of the biology of breast cancer and perhaps to helping women understand their prognosis and even eventually directing therapy.